Sister unmute ചെയ്യണേ. Carla sister unmute ചെയ്യണേ.
Sister, start ചെയ്യണേ. ഒന്ന് അൺമ്യൂട്ട് ചെയ്തിട്ട് സ്റ്റാർട്ട് ചെയ്യണം സിസ്റ്റർ. അൺമ്യൂട്ട് അല്ല.
ഹലോ
ആ സിസ്റ്റർ ഇപ്പൊ കേൾക്കാം.
ഓക്കെ
ഓക്കെ ആണ് സിസ്റ്റർ, പറഞ്ഞോ.
Dr. George, faculty members and friends. Today we have a webinar series 4 on the topic practicing pharmacy in a Canadian perspective. Dr. Jem, hearty welcome to you. Your old platform, that is St.Joseph College of Pharmacy. We cherish the good days you have spent with us. And you are really a gem in the field. Wish you good luck in your career and in your life. With great enthusiasm, you have explored the possibilities in clinical pharmacy in Canada. I'm sure you can enlighten our students. A just appreciation to the faculty members for arranging this program. In hope the blessings from above, let us start the webinar. Have a nice day. Thank you.
Thank you, sister. We acknowledge the initiative taken by Dr. St.Joseph, HOD, Department of Pharmacy Practice, and the encouragement provided by all my dear colleagues in organizing this webinar series. Now, I would like to invite Ms. Simi T, Department of Pharmacy Practice, to introduce our speaker. Over to you, madam.
Good evening to all. Today, we have with us Dr. Jacob Jem George, who will speak on the topic Practicing Pharmacy, a Canadian Perspective. Dr. Jem completed his B.Pharm from Chervandur campus MG University, Kottayam in 2001. He did his master's in clinical and hospital pharmacy from Kerala University in 2004. Soon after his post-graduation, he joined St. Joseph's College of Pharmacy as lecturer. In 2009, Dr. Jem completed the Canadian Pharmacy Skills Program from University of Toronto, Canada. In 2019, he also completed PharmD from University of Toronto. Dr. Jem is a certified diabetes educator as well as a certified smoking cessation counselor. He is highly skilled in parenteral administration techniques. He is a member of Ontario Pharmacist Association as well as Canadian Diabetes Association. Dr. Jem has been doing his exemplary service as pharmacist in Shoppers Drug Mart, Ontario, Canada from 2010 till date. On behalf of St. Joseph's College of Pharmacy, I welcome you, sir, to take over today's webinar session. Thank you.
Okay, so can I begin?
Yes.
Can I start?
Yes, sir. We can start.
Yeah, okay.
Yeah.
Okay, once again, thank you for the nice words from my junior, Simi. And also, I highly appreciate all the faculty members of St. Joseph College of Pharmacy, Sister Betty Carla, Bobby Sar, Sibi Sar, Vibin, all of you. Thank you for giving me the opportunity to present in your webinar series. So what I'm going to do today is I just want to basically give you an idea of the present scenario in Canada, working as a pharmacist, and also give you a roadmap for all the international pharmacy graduates who are wishing to coming to Canada to get an idea what to do and how is it like, and what are the time frame and what are the exams and all those things that you have to clear before you're able to practice in Canada. So before going into the details, I just want to give you an idea of how it's in Canada. So today's objectives will be to discuss, as I said, this current scenario of pharmacy in Canada and provide a guidance for the IPG or international pharmacy graduates to enter the practice in Canada. So Canada is a very huge country. British Columbia is in the west, and Quebec and Newfoundland are towards the east. It has like 13 provinces. I'm from Ontario. I'm from North Bay, Ontario, which is around the middle of Ontario over here. And Ottawa is the capital city of Canada, and Toronto is the capital of Ontario. So Ontario is the most populated state, like province in Canada. So those are some interesting facts about Canada. It is triple the size of India, but it only has a population of like 37.5 million, which is almost the same as Kerala. And so it's like 600 times larger than Kerala. So when we see like 600 people in Kerala, we only see one person in Canada. So it also has the longest coastline, largest number of lakes, third proven oil reserve in the world. These are some of the facts that I found in the string, so just wanted to share with you. Anyways, so Canada has a very systematic, very good healthcare system, and pharmacists are considered the drug therapy experts in the healthcare team. Pharmacists are an integral member of the healthcare team. So the usual roles of pharmacists are basically dispensing in the hospital pharmacy, preparing drug formulations in the hospital pharmacy, and also they serve as dispensers in community pharmacy, patient counseling, injection administrators, and all these things are basic pharmacy jobs. But in the recent years, there has been increasing, pharmacists are taking like expanded roles, and there are lots of new authorities that has been granted to pharmacists. So I'll be going through those in the coming slides. So this is a poll, there's a public poll conducted by British Columbia Pharmacy Association. So most people, almost 90% of the people have positive impact on positive impression on pharmacists. So they believe that pharmacists can do a very good job in caring for the patients, and also it is they act as a complementary member to the healthcare team. So Canada has roughly around like 42,500 licensed pharmacists working in 10,000 pharmacies. So 70% of them work in like community pharmacies, and around 50% works in hospitals, and 15% work in other settings. There are other settings such as pharmaceutical industry, other colleges, universities, and other associations. So these are the various scope of pharmacy practice in Canada. Apart from the regular dispensing and patient counseling activities. So if you see here, it varies according to the provinces. So if you look at Alberta, AB is Alberta. Alberta has the most scope of practice for the pharmacists. So in that province, they can prescribe any Schedule 1 drug. Schedule 1 drug means that drugs which can be dispensed only by a prescription. So pharmacists has independent prescribing rights in Alberta, but they had to undergo some additional training for that. And those prescribing authority pharmacists can prescribe any scheduled drug. But they have to monitor the patients, and they're individually responsible to take care of the patients. But here, if you see NU, this is Nunavut. This is one of the most northern territories of Canada. So in the province, they have not implemented any of the scope of practice in Canada. My province is Ontario. Here you can see we have some rights or scope of practice. So we can counsel patients and prescribe for smoking cessation, and we can prescribe in case of emergency situations where somebody is not able to see the doctor, or they ran out of their prescription and then they cannot see the doctor. In that case, we can prescribe it. And also we can change the formulation, we can adjust the dose. So these are some of the rights, and we are also considering prescribing for minor ailments. So it's pending legislation, so it's not we have not passed the law, but it's coming very soon. So other things we can do is administer any kind of vaccine, which includes like travel vaccine, seasonal flu vaccines. So right now is a busy season for us. We are in the middle of flu season. So it's a very busy time. We are administering lots of flu vaccines. And hopefully in the next year, we'll be administering the vaccines for COVID. So these are some of the things that we can do practicing as a pharmacist. And there's another category called regulated pharmacy technicians. Recently, in the last 4 or 5 years, they have been regulating pharmacy technicians. So they also play a role in the pharmacy. They can refill the prescriptions, check the refill prescriptions, and also they can talk to the patients, but under the supervision of the pharmacist. So this slide is for a person who wants to study pharmacy in Canada and then work as a pharmacist. So the basic degree is a bachelor's degree from the Canadian University, or it could be a family degree. And then you have to pass the exam by the Pharmacy Examining Board of Canada, except in Quebec. And then you have to gain some internship knowledge or experience through internship program. And then you have to have the fluency in English or French. So the pharmacy is regulated in a provincial and the territorial level. Province and territory are almost the same. So we have, in Ontario, we have Ontario College of Pharmacists, which is the pharmacy regulating authority. They oversee the licensing procedures, as well as keep the register for the pharmacists. So these are the various pharmacy schools in Canada. There are like 10 pharmacy schools in Canada, and Quebec has 2, which is French. The rest are English. So Canadian education is one of the best in the world. So you can see more than half of the Canadian universities are ranked, especially in the pharmacy and pharmacology, in the top 100 in the world. So education, quality of education is very good here. And so when we are coming here, we have to compete with one of the best pharmacists in the world. So you have to prepare. You have to be prepared for that, especially when you're doing your studies, if you want to come here. So there's another opportunity for pharmacists to do Canadian residency program. So basically, it's 1 or 2 years residency in a Canadian hospital. If you do decide to go to some specialized field. So most pharmacists work in the community, and some work in the hospital, and some wanted to specialize. So those pharmacists who wish to specialize in a certain area, you can apply for residency, and then you can gain experience during that period of time in a specific field, and then you can work as in a specialty pharmacy field. So it needs to be to do that, you need to be a Canadian citizen or landed immigrant, or you need a Canadian work permit. So now, for international pharmacy graduates, there's a website that you have to enroll to begin the process of licensing in Canada. It's called pharmacygateway.com. I have provided the links in the later slides. So once you enroll in that website, they'll give you a national ID number, and then you begin the process of the licensing in Canada. So before getting the license, you have to clear the document evaluation, which includes your transcripts, and also if there's a license in your from your country, or if you have a license in India, you have registered as a pharmacist, then you have to get a good standing certificate. And there are some other documents too, which is can be found in their website. So I provide the links of these at the end of the slides, so you can go and have a look to see what documents you need. So once the document evaluation is done, then you can apply to the PBC for the evaluating exam. Evaluating exam is to see if your pharmacy program in another country or in India meets the standards as the education here. So once you pass the evaluating exam, then you can apply for the qualifying exam. The evaluating exam is a multiple choice exam. There are around 200 questions, and 150 of them are intended to be valued. The other 50 questions are test questions. So we don't know when you answer these questions, which one of them are marked for valuation and which one are for test questions. So basically there are 200 questions, and you have to get like 60% to pass the exam. So after the evaluating exam, the next one is a qualifying exam. The qualifying exam has like two parts. One is a multiple choice exam, and the other one is called OSCE. So I will go through that in the later slides. So once you clear the qualifying exam, then you apply to the Pharmacy Regulating Authority. So Pharmacy Regulating Authority is Ontario College of Pharmacists in Ontario. And then you will get a student or intern license. It's not a license, student or intern position. And then you undergo a structural practical training. It's called PACE. It's like a 4-week training in the, it's not a training actually. The pharmacist, you will be matched with a mentor, and then you will be asked to work in that particular pharmacy for 4 weeks, and they will be assessing you during that time. And then he has to okay you so that you have the necessary skills to practice in pharmacy. So it's basically a assessment for 4 weeks, and then you have to get the final okay from the mentor to get the license. And once you get the license, before getting the license, you have to also pass the jurisprudence exam, which is different in each province. Each province, as I said, is different scopes of practice. So each province has a different set of laws. There are federal laws and provincial laws. Federal laws will be the same, but the provincial laws will be different in each province. So he has to pass that exam before getting the license. So once you pass all these exams, then you apply for registration, and then you will be licensed. So this gives you the basic information about the cost as well as the various requirements. So one more thing about the English language. So Canada has 2 official languages, English or French. So to get a license, you have to pass the IELTS or any of the equivalent English proficiency tests. So I'll have a slide on that later to various like. Sorry, a second. So I have a slide on that to see what are the scores that you need to pass this exams, and then minimum required scores to get the licensing. So as I said, there is 2 tests, which is the there's after the evaluation, and there's like qualifying test 1 and 2. One is the multiple choice, and there is OSCE, which is a practical or practical or like case-based test. So for a pharmacist in Ontario, there is a mandatory bridging program, which is by University of Toronto for international pharmacy graduates. So you have one option that if you pass the qualifying exams 1 and 2 in the first attempt, you can opt out of the program. But if you fail any of these exams, the qualifying 1 or 2, then it's mandatory that you take the bridging program. It's a particular program for international pharmacy graduates to equip them for the skills to practice in Canada. So this is the minimum time that is required to become a licensed pharmacist in Canada. So as I said, this is the minimum time. But once we come here as a student or an immigrant, to survive, we have to work. So we can study only as a part-time. So it will take more than 1 year to get the license. So we cannot, most people doesn't clear the exams in the first chance, or most people cannot appear for all the exams at the like recommended time. So it will take at least an average of 2 to 3 years to clear the exams. So if you calculate the minimum required time, it will be like around a year, and the cost is around like $6,000 Canadian dollars. So this is this slide gives you an idea of the various English proficiency tests that's required. So the most easiest one will be the IELTS. So you have to get an overall score of like 7, and with a minimum of 6 in any of these areas: speaking, writing, reading, or listening. So this is a exam a blueprint for the evaluating exam. As you see, the pharmacy practice here covers like more than 50% of the exam content. So when you study, you have to be give importance to therapeutics a lot. So you have to have a good grasp of pharmacology and therapeutics, and also there are other subjects too. You have to have a good grasp, but most of the contents is basically in the clinical sciences. So these are the average pass levels in the last 3 years. So the average pass level is like on like 50% for the first time test takers, and the repeat test takers is also like 50%. This is for the evaluating exam. So there is a maximum of like 3 attempts for you in the evaluating exam, and once you're done the 3 attempts, if you don't pass, then there's another 4th attempt after remediation, which means that you have to work in a pharmacy for around like 600 hours, and then you can apply for the 4th attempt. And if they grant, if they think that if you have sufficient experience, they will grant you the 4th attempt. So it's not necessary that everybody gets the approval, but it's very important that you prepare for the exam before you write it, in order not to waste the attempts, because there's only a limited amount of attempts. So the qualifying exam, there's 2 parts. Part 1 is the multiple choice questions. Similar to the evaluating exam, there's like 200 questions, and some of them will be test questions and will not know which one is which. So you have to basically answer all these 200 questions. And this qualifying exam is written by all the Canadian graduates as well as international pharmacy graduates. So it's very tough exam. So you have to be very prepared to pass this exam. And so there are some textbooks that I recommend to study for this exam. I will have a slide at the end of the presentation to go through. And also the OSCE is objective structured clinical examination, where you are presented with patient cases. There will be actors, which actor patients. You will be given a clinical scenario where there's a actor patient, and there will be an assessor who's watching you, how you interact with the patient. And there might be some scenarios where the patient is coming with a drug therapy problem, and then you have to solve it. Sometimes there might be a scenario with a physician asking drug information questions, or sometimes it might be like a patient coming to community pharmacy asking for a solution for his problem. So there are like 14 stations in the exam, and 1 or 2 will be test stations, and you have to meet the necessary communication skills as well as the knowledge skills, as well as drug problem detecting skills. So these are some of the skills that you need to pass this OSCE. So your assessor will be assessing and marking these, and then you'll get a you'll have to get a pass mark for the exam. But when you come here, it's very different because we are not used to the case-based studies. So we had to be very prepared for the exam. So there are some coaching classes that you can take before sitting for these exams. So these are the exam dates. There are basically two exams, two dates, two sets of exams in the coming year. So for the qualifying exam, the next date is in November, and usually it's every 6 months. And for the evaluating exam is in January and then sometime in June. So there's two exams in a 1 year period. So these are some of the bridging programs for the international pharmacy graduates. One is by the University of Toronto, and then the other one is British Columbia. The other one is from Alberta. So I will say it's a good idea if you undergo these programs, because you will be more. There are more chances of passing the exams. But you can always try writing the exams before taking part in these programs if you're confident. And the other thing is it costs money. So it's better to practice and to prepare well for the exams before you take the exam. So these are some of the resources that you need to, these are the Canadian resources. The others are standard resources that if you're Dipuro and Kodak Impel, these are the standard books that you have to read and practice case studies from before taking the exams. These are the Canadian references. So the therapeutic choices, it's a standard textbook in the Canadian curriculum. So you have to be very familiar with the therapeutic choices. So if you can get a hold of the therapeutic choices in India, either it could be, it can be purchased online, either through the institution or individually. So if you can get that book and then get familiarized with that book, then it will be an advantage too. So these are some of the useful links that you can go through to get a further grasp of the situation. So the thing is, I only prepared a brief set of slides. I don't want to bore you with a long set of slides. So if you have any questions, you can always ask me. So the next 20 minutes for questions from the students. So if you can ask me any kind of questions, I can answer whatever I can, and then I'll be able to get back to you like whenever, I can contact Bobby sir or CB sir or Vipin sir. If you have any questions, you can ask me now, and then I'll get back to you. So
yes, sir. Thank you, Dr. Jacob Jim. I'm Naveen Kumar Panikar, a faculty here. So it was nice hearing from you. Yeah, it was nice hearing from you. And it's question time. So participants, if you have any questions, you may please put it in the chat box so that we can ask sir and then get your queries cleared. So if you have any queries, please. So I just wanted to know one thing. See, many of our students do go to study some courses in Canada. Like you said, it takes at least 1 year to clear the exams, minimum of 1 year. So people do go for courses. So any course that you would prefer or you would recommend, because there is this MPH course and this technician courses that I have heard students going for. So would you recommend any course that would be useful for them?
So I'll say MPH is a good course because it's something related to the pharmacy, and once they get licensed as a pharmacy, and they can always, there's a chance to get an administrative post in a hospital. So something related to pharmacy will be great. But if you don't get those courses, if your aim is to come to Canada and then get licensed, any course is fine, but try to do some courses which are related to pharmacy or in the healthcare field, so that you can always transfer the skills to the course, and it will be easier for you to study the course, because it will be hard for study and prepare for the exam at the same time. So if you have some kind of background knowledge in the course, it will be easier to do the course and as well as prepare for the exam. Yeah.
Thank you, sir. So I think there are a couple of questions. I think one is something related to what we were talking. One is James wants to know whether it is better to take a 1-year pharmacy course or a 2-year pharmacy course.
So is it pharmacy course or just any course?
That's what she has mentioned, taking a 1-year pharmacy course or a 2-year course. What is your
So
opinion?
there's no 2-year pharmacy course here. There's the other course is pharmacy technician course, which is like a diploma in pharmacy in India. So I don't want to take that course after studying PharmD or BPharm. So it's better to take a postgraduate course in any field. And then I think if you take 2-year course, you'll get a stand back visa for like 3 years. So during that time, you can clear the exams. And I think for 1-year course, it's like, I think it's 1 year stand back. So if I remember, so it's better to take the 2 years if possible, so that you have some time to clear the exams.
Right, sir. And the next question is from Christy Babu. Is there any difference in the licensing procedure after getting an MS from Canadian University?
No, there is no difference in licensing procedure. If you have an international educated pharmacy, that means that if you have completed your graduation from any other country except US, then you are considered as an international pharmacy graduate, and then you have to do the evaluating exam as well as the qualifying exams. So if you do the basic qualification in pharmacy in Canada, then you just need the qualifying exam. Okay. Otherwise, you have to do the evaluating exams.
Right. And then there's this question about acceptance of PharmD students into research-based masters in Canadian universities.
So if you have a good profile, then there are lots of opportunities in main universities. Like U of T is one of the best in Canada. So there, it's very hard to get through, but there are lots of international students doing MS in U of T. But you have to have a very good academic background with voluntary services and research papers and all those things. Then you stand a good chance. And then you have to have good English proficiency, good scores in IELTS, and then good GPA. So all these are possible, but yeah, so you have to work hard while you're studying, and then make sure that you have good academic background. And then it's possible to do MS or even PhD in Canadian universities. Yes.
Right. So, and how about the French-speaking areas? Do they have any advantages?
If you have a bilingual, if you know French, it's a great advantage, because some areas prefer English and French. So if you know the language, then it's easier to get a job. So if you want to study French, that's fine, but the level of French is different. So you have to be really fluent in French to consider you for the job. So there are certain areas. Quebec is exclusively French. English is rarely spoken there. So, and also in northern parts of Canada, there is lots of French. So some jobs, pharmacist jobs in Canada prefer bilingual. So there's lots of chances for bilingual person.
Thank you. I don't see any questions. How's the weather now there, sir?
The weather is getting colder. Now it's at the end of fall. So it will be much colder in the coming weeks. So winter starts here from November to April. So it's like 5 years of winter, five months of winter. Yeah. So it's it's one of the coldest places on earth. Yeah. So do you have any other questions? How do you practice pharmacy in Canada? In the hospital, I have done some rotations in the hospital. In the hospital, there's like ward pharmacists as well as like clinical pharmacists. The ward pharmacist basically is a part of the healthcare team where they do daily rounds for the patients. There'll be meetings every day with nurses as well as physicians and social workers. We go through all the patient profiles and care plan for the patients for that day. So it's a daily process. So pharmacist has a great input in drug therapy and dose changes and all those things in working in hospital. And there are clinical pharmacists in hospital who are specialized. For example, there's like cardiovascular pharmacists, there's renal pharmacists. The renal pharmacists are responsible for adjusting the drug doses for patients who are in dialysis and severe kidney problems. So the doctors always ask the pharmacist to adjust the doses as well as to recommend therapies in these patients. So once you specialize in a certain field, then everybody asks you about, even the doctors ask you recommendations, and it's very valid. You value the recommendations very much.
I understand that one. Okay, Ms. Prace wants to ask a question. So then I think you can unmute yourselves. Let me see if I can unmute you, and then you can ask a question. Sorry, I'm not able to get Praise. Bobby sir, can you just help me out? I can't get Ms. Praise on my participant list. So can you just unmute her? Because I think she wants to ask a question.
They can unmute themselves. That option is
Okay.
given to them. They
Okay, then
Grace and Maria, I think.
Okay, then you can please unmute. I think first it could be Praise who can unmute and then ask the question. Praise, if you're there, please. And Jenny ma'am, who was the other person?
Maria John.
Okay, Miss Maria John, if you have any questions, you may please ask now. Okay, so I don't see anyone asking any questions, sir. Okay, one more last chance. If anyone wants to ask any questions, you may please unmute your mic and then ask the questions.
Yeah, don't worry. It's you treat me as a friend. So you can ask any questions. So
They're afraid to ask a teacher, sir.
yeah, I'm not a teacher. I'm just a student. I'm still studying. I'm just a student. I'm still studying. So you can ask me. Consider one of my students. So you can ask me any questions. Not a problem.
So just out of curiosity, now, do the clinical pharmacists, the community pharmacists, or hospital pharmacists have a different licensing exams, or do they have anything that is different?
No, basically the basic qualification for the clinical pharmacists and community pharmacists are the same. Okay, so some choose to work in community pharmacy and some choose to go work in hospital, but basic qualification is the same. This is either it's a 4-year graduate program or it's a PharmD program. So Some prefer to be specialized in certain field. For those people, there's residencies, as I said, like say 1 year and 2 year programs where they can get specialized in certain field, where they can get experience in that field, and then they can be a specialty pharmacist in certain area. But usually it's a very tough process, and there's only a limited number of seats, around like I think it's around like 200 or 230 positions available in 2020 for residency. So it's a very competitive field to get into. So and also the rate of acceptance is like only 1/3. So only the best of the best will choose for it, and then only the best of the best will go for that. But basically, clinical and the hospital pharmacy, they have the same basic qualification. And you become experienced in after working in a particular area in the hospital, and then you basically become a clinical pharmacist after experience, and you become a community pharmacist if you're working in the community pharmacy. So they have basic qualifications the same.
Yes, anyone wants to
Hello,
ask a
hello, Nitin.
question?
There's Nitin that's joined, and if you want to add something, you can add to the discussion. He has also experienced pharmacy in Canada.
Hello. Hi. Just would like to add a couple of more things. The practically the international students, what they do is usually they come to Canada. Usually they take the 2-year pharmacy technician program, and which gives them an opportunity to stay back 2 to 3 years here on work permit after the 2-year program. So that 3 year would help them to get licensed. They'll get more time to get into the pharmacy system, whether it's retail, just like the community pharmacy, or sometimes if they have luck and they are competent enough, they get a hospital experience as well. So then they can work in the hospital, and meantime, over the 3 years, they can go for these exams, and by the same time they can apply for the permanent residency in Canada. So that's how most of the kids they do, like they come for the 2-year program, they stay back 3 years, they apply for the pharmacy exams, and after that they apply for the permanent residency. That's the general trend that I see, how kids are coming after the um, after their, even if they have done the pharmacy graduation or post graduation, anything like that. So that's a practical consideration. But if they are opting to choose any other programs, ideally it's better to have at least 2-year program. By that they get approximately 3-year stay back and get work permit for those 3 years.
Thank you, Dr. Nitin.
Thank you, Nitin.
I'm no doctor. I'm just a graduate. So,
So you have more practical experience.
yeah.
You did the technician course, right?
Yeah, I did. I came here in a permanent, like as a PR. But first I went through the technician program. First I got licensed as a technician, and after that I was going through the other exams to get my license as a pharmacist. So it took a while to get my license, but just like Jem cleared all the exams in the first attempt, I had to clear. I had to do almost like a couple of attempts to get there. So anyway, it's a little bit tough, but like you have to focus on your studies, and yeah, you will get there.
Yeah, everybody gets there definitely at some
Yeah.
point. Might take 2 or 3 years, maybe 4 or 5 for some people, but eventually everybody gets the license, almost all of them. So it's a good opportunity to come here. And then nowadays there is a little less demand for the pharmacists, but definitely you'll get the job somewhere. Like earlier, like 10 years ago, there's always a high demand because the supply was over, but there's lots of people coming from outside, and there is like another school in Ontario, like Waterloo, they have started, and there's lots of students coming, graduating from there every year. So the demand is less, but definitely is a good job and highly trusted, one of the most trusted profession in Canada and a highly respected one. So you'll definitely get a job somewhere in Ontario or in Canada. So it's a very good idea to look for Canada, to migrate or come here to study, and then pass all these exams and get the license.
Right. So there's one more question.
Yeah.
Miss Maria Teresa has asked, is it possible to do a bridging course in Canada for a pharmacy graduate in India?
No, because they offered a full-time bridging course, online bridging course, but I don't think it can be done from India. You have to have the bridging course here in person. It needs visa, and the bridging course is not enough duration. It's not a 1 year duration. It's like a 6 months duration. So you cannot get a visa to come here just to do the bridging course. It has to be at least a 1 year program to get the visa, study visa. So I don't think it's possible. And it's
I think with that.
Can I add one more thing?
Please, sir.
Yeah, go ahead.
Okay, so we have a retail pharmacy or a community pharmacy, and there are hospital pharmacies. And the pharmacy that I am working, it's a different pharmacy other than these two. When you compare the hospitals in India, right? The patient goes to the hospital, and if they need to have any IV medication, patient has to stay in the hospital to finish their IV therapy, and the doctors will be switching to oral medication, and they'll be discharging the patients to home. But here there is a different concept. It's called home care. So how does it work is, if a patient has an acute condition, they go to the hospital, they get their initial therapy there, for example IV, and after the patient is stabilized a little bit, they send these patients to home, and there are pharmacies who make this IV medication in the community, and they'll be sending this medication to the patient's home, and there are community nurses. They'll be going to the patient's home, and they'll be infusing these IV medication at the patient's home. So the patient doesn't need to stay at the hospital for a long time, which prevents hospital acquired infection and that kind of stuff. So that is one of the treatment that is given in Ontario province. So I am working in one of those pharmacies which makes IV medication. So there are different opportunities here as a pharmacist once you come here. So depends where you are working, you'll get a job there in that sector. And there are, like, one more thing, there are palliative sector actor as well. The palliative patients, they stay home, and some of the pharmacies, they specialize in sending this palliative medication to the patient's home. So there are different areas of pharmacy that you can look for a job, and they can get it. Yeah.
And also there are like long-term care pharmacies where you worked as a in facility pharmacy, and then you can provide patients to drug therapy there too. And also there's like addiction pharmacies, so they just deal with methadone or there is like lots of opioid abuse going on in the community. So there are pharmacies which specialize in methadone maintenance treatment. So the pharmacists certain pharmacists can work there too as a member of the addiction team. So there's lots of opportunities there, and as a pharmacist, there's wide variety of scope. So all this needs a basic license, So the aim should be to get the license, and then you can choose the field where you want to work according to your interests.
Right, so thank you. And I think one last question, sir. One, Mr. Jose wants to know how we're taking 2 one-year courses, that is one advanced diploma in biotechnology and one graduate certificate program in regulatory affairs. Like he wants to take 2 one-year programs.
2 one-year programs. I'm not sure about it if it's considered as like 2 years, or Nitin, do you have any idea?
No, I'm not sure. I'm not sure about that. Only the thing is, whatever program you take, your intention is to get a pharmacy license. So you need to provide some time for you. So basically, you need to choose a program which gives you more time to stay in Canada and work for a couple of years. By the time you apply, you finish all these licensing procedures. Sometimes, if you fail one exam, it it is adding at least 6 to 7 months for the next exam. So you need to provide that kind of stumps, that kind of time basically. So choose a program which gives you more time back in Canada to work by the time you get licensed. That should be the intention, irrespective of any program you choose. That's my probably the opinion about that one. So
I think that's a more practical way of looking into it, right, sir?
yes.
Okay, so with that, I think we will have to wind today's session. It's been very interesting, and I must say that Dr. Jem, you are a real gem, and we could get a lot of I'm sure the audience have benefited from hearing from you, and we got a bonus in the form of Mr. Nitin, who also actually joined in and then came out with some practical solutions. And I'm sure all the students who are listening to these talks would have been benefited. So once again, I would like to thank both of you, Dr. Jem and Mr. Nitin, on behalf of the college and on behalf of the audience. We really offer our sincere thanks to both of you. It's been a pleasure having you both. And then the other formalities, like I would like to have Dr. Sister Betty Carla, our director, for supporting us and encouraging us. And of course, our principal, Dr. Sister Daisy PA, also, who has been supporting and guiding us. So sincere thanks to both of them. And then, of course, our Sibi sir, who's the chief organizer, running around. And then Bobby sir, who's sitting there, who's our technological lead, along with Chutnamal sir. So they have been very useful. And all these days, I've actually left out one person who I happen to see on the screen now, and I'm remembered, Mr. Vipin Xavier. Thanks for all those attractive flyers. They have been very good. Thank you very much, Vipin sir. And then, of course, Simi ma'am for that nice introduction. Now, I haven't left the audience. Audience, you were too good. You had too many questions. So that shows that you were really involved in the sessions. So thank you for being a good audience. And as we told, we will be having a couple of more parts of these seminars continued in the coming days. So please do join us. So thank you all. It's been nice. Jenny madam, as usual, we both did a good job, right? Okay, then thank you all. So this is Naveen Kumar Panikar signing off from St. Joseph College of Pharmacy. Thank you very much. God bless.
Okay, thank you.
Thank you.
Thank you, Nitin.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.